Hello, and welcome to the Radiant Mission podcast. My name is Rebecca Toomey, and we are on a mission to encourage and inspire you as you're navigating through your life and with your relationship with Christ. We have been in a series on being countercultural, and as listeners of this show know, we love talking about birth and God's design for birth. And for the last 2 weeks, we have featured Dr. Nathan Riley, a hospital OBGYN who left the system to support midwives and home birth. In our first episode together, which was episode 128, we discussed the spiritual significance of childbirth and its impact on parenting. We questioned the necessity of pharmaceutical interventions in maternity care and emphasized the importance of personal empowerment in making birth choices. And then last week, in episode 129, we discussed men and women's healthcare. We questioned routine gynecological procedures like annual pap smears and HPV testing, discussed the very rich history of childbirth and Nathan's reasoning for leaving hospital practice, how COVID created a paradigm shift, which gave many people permission to question authority and say no to medical interventions that they didn't feel comfortable with, and how the medical system operates exactly as designed, profiting when women outsource their power rather than trusting their bodies and intuition. This week, we are rounding out the conversation by touching on some of the questions that followers of the Radiant Mission asked, including a discussion surrounding RhoGAM and clinical studies, emergency scenarios during birth, and more. So, tune backwards if you've missed the conversation up to now to episodes 128 and 129. And if you're already caught up, we're going to jump right into this conversation with Dr. Riley. Because that's what it really comes down to, is like you have to break down those mental barriers that say, this is what everybody does, and I'm not going to do it. Interestingly, my first birth was in December of 2019. So it was just a couple months before COVID happened. Now, had it been into COVID, I think the result would have been the same, but it's interesting because I had my first and then COVID happened, and then COVID was a ride. Like you said, I mean, we didn't know what was going on in the beginning. My husband was watching all these Chinese propaganda videos in the beginning. He went to the grocery store wearing all this crazy stuff. Didn't know
Yeah,
if we were,
of course, we don't know. There's like Humvees
we don't
sitting around.
know.
Yeah, it's like, what the heck?
It was crazy in the beginning, but we also saw something early on from Catherine Austin Fitz, which was she has the Solari report, and
Yeah,
she had made this video, and it didn't have anything to do with COVID, but it was kind of like she's been awake to this stuff for far longer than we had been. And it opened up a lot of things, but I do think that you're right that COVID helped to open up a lot of people's minds and brains to what's behind the curtain. Now, the political side of things, I can't even have a political conversation because I think the whole thing is such a joke. But
yeah,
it's
it's pretty silly.
hilarious. It's hilarious to me that, first of all, the blue and the red have swapped so many times, have like changed and morphed. And then people be like, oh, back in, 100 years ago, Democrats were actually Republicans and Republicans were Democrats. And it's like, yeah, it's still going on today. I can't help but I don't have any trust for any of it. I have zero trust in any of these people. Like the trust has been broken, let's say, because let's take the red, for example. And the last time the red that is now going to be president was red, he was warp speed. He was Mr. Warp Speed. Here you go, everybody. Everybody take it. I made this vaccine in 2 seconds. Take it. And now it's about RFK breaking down the breaking the system down, finally doing vaccine testing, and I don't buy it. I think
Yeah,
everything is a test to see what people do. Like we're rats in a cage, and as we make moves based on how we're controlled by what the media puts out in front of us, it's what was their response to that? All right, let's control them again with
Yeah, it's a
this
compliance
information.
test. It's what it is. It's a compliance test. Yeah.
Uh,
How far
There,
can we get Rebecca to budge this way with this tactic? Oh, she was going to go that far. Okay, that's the new normal. And we'll get her to go a little further, and we'll go a little further, and then suddenly you find you're in a completely different world. Yeah, I
it's
agree
like the
with you.
education system. You mentioned it earlier that the education system is not made to actually promote creativity and to promote, it's to create workers,
Yeah,
to
yeah,
create employees that follow the rules and do things a certain way. Because if it was about creating good, happy, healthy human beings, then they would teach children how to do their taxes. They would teach children about how to write, how to balance their checkbooks, how to save money, how a cycle works at the
yeah,
age appropriate as girls are getting, like, it would be an actual class that is taught. I mean,
yeah.
I didn't learn about fertility awareness until I was 31 years old.
Isn't that wild?
31.
Yeah,
It's ridiculous. Like, it's actually a joke because I should have learned that as a teenager. And now here I am, a geriatric old pregnant person. If I was in the system, that's how it would be labeled. Saying, like, girls, you gotta, really women, you've got to educate your teenage daughters on this stuff because if you don't do it, no one is going to do this. No one is going to teach your daughter about their fertility. No
that's
one.
right.
But our culture is so taboo about this. And even in Christian communities, it's like, well, I don't know how to talk to him about it, or I don't know enough about it. It's sad because I didn't know about it till I was in my 30s. And now I'm talking to other 30-year-old women about it that they didn't know about it. And we're all having to learn all this stuff. So then we can now pass it to the next generation, which is great.
Sure.
But so much of just the natural, how our bodies work stuff is completely lost. We are totally dependent, like you said earlier, we're totally dependent as women on the medical system. They've won us. We're customers. We keep coming back. We have not taken on the authority or followed the intuition on our own. But I mean, we go to other people for questions on everything though, even when we become mothers. Well, fevers. Oh, I'm so scared that they have a fever. I've got to reduce it. For what? What are you reducing? What are you
Yeah,
reducing? Are you reducing it because you were told to reduce the fever? Because you want your kid to go back to school tomorrow? What is the reason behind, and I used these words earlier, suppression. It's all about suppressing everything. We've got to suppress. They have a sickness, suppress it. You have a period and it sucks, suppress it. Don't possibly look at what can help support your period. No, just
yeah,
get rid of it.
that's
It's all
right.
about convenience. But
Yeah,
now, see, now I'm
and
starting to get
control.
into territory where you and I agree too much. I can't do that, right?
We had a good run.
We had a good run. We fought it. I fought as hard as I
Yeah.
could. But yeah, go ahead. I'm
No,
gonna
that's
mess with
it.
my window for a second. That was it. Okay.
Yeah, I didn't have anything more to add to that point. Yeah.
I don't want to. I know we've been talking for a long time. You have a family, and I don't want to keep you just talking forever. But this has been great. I don't know. I feel like it has been. It's been a very just open conversation that I don't think is had enough. But I don't want people on Instagram to be like, you didn't ask me my question. So let me
Well,
see.
go through some of the rapid fire ones maybe just to
Okay.
make sure.
So the ones that were from home birthers, I had a variety of questions that were all the same, but it was about talking about men practitioners in the birth space. And there is one thing that I want to say about men in the birth space. Like I said, I went to male OBGYNs in my life. Not, I had interest there. Every experience was memorable, mostly because the first two were hilarious. They were like these guys from Long Island, and I lived in Connecticut at the time. So they were just really funny to me. Um, Another one stood out because so I had RhoGAM during my first pregnancy. I'm negative blood type, my husband's positive. And I bought into the whole RhoGAM bit back then. And I say bought into because now I like unsubscribed. I literally just made the decision that I unsubscribed from the narrative around blood stuff. And that's my own personal choice. And, if you want to
What
question
didn't
that,
you
it's
say?
cool.
Yeah, so like because life is in blood, didn't you say that in the
Yes, I
Bible?
did. I did. Yeah.
Which, by the
Because
way, like the Chinese medicine practitioners of 6,000 years ago or something, qi, like that blood is a living, there's a living quality to blood. We'll talk about that
Mhm.
next. I'll give you
Yeah, that
some,
actually is what
some
changed
stuff
my
to talk about.
RhoGAM was what changed my perspective on blood, to be honest with you, because
Yeah.
I had the first injection and I had a crazy reaction to it, but I didn't know it was from RhoGAM until I had the second injection. And then I had an anaphylactic reaction to RhoGAM. And that's when I finally was like, what is this? What is this made out of? And went down that road, that comes from human plasma and it's pooled blood. It's a bunch of people's blood all mixed up together. And there is a spiritual aspect to that as well. And like, you don't know what medications people are on. They cannot filter out diseases or, anything like that. So you don't know what you're getting. You're getting anything. And because my body had the reaction that it did, I have to tell you, it was creepy. So the first one, I had this injection, and then a couple days later, and again, I didn't think anything of it because we're not taught to question our reactions after we have shots or vaccines or injections or whatever the case might be. We're not taught to look for, things later. I started developing itchy hives in different places on my body, and they would come and go, but they were so itchy, I wanted to rip my skin off. And I felt like it was something alive underneath my skin. Like, oh, I was looking up, is this scabies?
Hmm.
Because it felt like a living something was alive
Yeah.
underneath my skin. And it was so painful. And my OBGYN, who was a woman, was totally useless. She was like, have you taken an oatmeal bath? I'm like, lady, I'm telling you, like, this is bad. This is more than oatmeal bath bad. Like, yes, I have. And, oh, put cortisol cream on it and stuff. This is coming from the inside. Something inside of me is happening. It's not external, it's
Hmm.
internal. And then, I'm the one who asked her, is it my bile? I'm doing the research to try to figure out what the problem could be, thinking maybe it's pups or whatever they call it, which now I think that pups is often a way that the medical system uses to diagnose people with skin conditions that they just don't understand. But that's, again, my opinion. And I literally paid for an ebook that this lady wrote. It was like $3. And she wrote it, it was how a remedy for pups. And the way that she wrote this, it was like she understood that something was happening internally inside of her body and that you needed to cleanse your
Yeah.
liver because something is attacking your
It's
liver is
absolutely what you should
used to
do. The
process,
liver.
right?
Mhm.
So I started taking high doses of dandelion root, like
Good
in
for you.
capsule format. And then I basically was like, no processed food, only clean, vegetables, fruits, that kind of stuff. And within a week, my body started to clear up. And then by 2 weeks, I was all the way better. And I continued to take dandelion root. My OB, when I told her about this, it was like she didn't even give two craps. She was just like,
Mm.
great, good for you. And I'm like, man, what a missed moment. Like, what a missed opportunity that you're not hearing that something that is attacking the inside of the body, if you treat it, if you try to clear the blockage that's happening, because clearly I was having a histamine response and my liver couldn't process it.
Yeah.
It
Right.
couldn't clear it on its own. It needed assistance. And I did take um whatever it's called, um antihistamines. I did take Benadryl to try to I took everything at this point. And this was, when I'm trying to avoid taking anything because I'm pregnant and I'm like, I'll take a, the allergy pill, whatever. Um, After going through this experience and then kind of being like gaslit about it, And then I had the second dose when I had the baby. After I had this horrific C-section, they give me the second one and I have the reaction again. And I carry an EpiPen with me, actually, because I have an allergy to red 4, which is carmine, which is made out of crushed
Oh,
beetles, not red
red
40.
4.
Red
Oh, red
4,
4.
carmine. Yes. Which that's a whole other side story that took forever to figure out, that I had to figure out on my own because the allergist couldn't figure it out. But there are these little bugs and they release this red poison, and we use them for red coloring in cosmetics and food products in America because we're really smart.
Hmm.
And a lot of people are allergic to it because it's a poison at high levels. So, anyway, I have this reaction. They have to use my own EpiPen on me because they're like, it's going to take us too long to get one. We'll just use yours. And then they're like, what did you eat? What did you do? Why did you have this reaction? And I'm just like, I don't know. You guys gave me a RhoGAM shot an hour ago, 40 minutes ago, whatever it was. So in the end, they're finally like, I
That's interesting.
guess, I guess it
Yeah.
could be from that. I guess. So going into that, my next birth, I mentioned to you, I went to an OBGYN and it was a male OB. And then he had another male partner OB. So I saw this other guy the second visit, and he walks into the room and he like has my chart and he goes, oh, you have bad juju. So he walks into the room. I never met this man before. And that's what he says to me. I'm like, excuse me? And he's like, you had an allergic reaction to RhoGAM? I've never heard of that. And I'm like,
Hmm.
okay, well, it happened. And then he's like, okay, so we're going to have to figure out how we're going to manage this if you can't get a RhoGAM shot. And I'm like, there's nothing to manage. I'm just not going to get another one. He's like, yeah, well, could be a big problem. Could
So
be a big problem. And I'm like,
what did he tell you about the risk if you didn't do it?
this guy knew nothing. And the more I pressed, the harder it got for him to answer. I kind of wish my husband was here to
Well,
tell this
hang on,
story
hang on,
because he
hang on.
was
This
hilarious.
is a doctor. He
This
knows a
is
lot of. What did he tell you? What did he choose to tell you?
this is an yes, you're right. This is an OBGYN who says, because I'm like, okay, well, what is going to happen? And he goes, well, you know, maybe we could maybe tell if your baby has a problem in utero. I heard that the skin looks kind of weird. And I'm like, what do you mean the skin looks weird? Like, yeah, if you get sensitized and you pass it to your baby, their skin will look kind of weird. So we could probably tell if there's a problem. But I don't know. I've never
What, like
actually
after
done
they
this
were
before.
born?
No, he meant like from an ultrasound.
Oh. Hmm. Well, I don't know what to say about any of that.
He was very it was very clear that from the interaction that I had with him that he's just a procedure guy. He does what he always does. And this was the first time that he had had somebody come in that's like, I'm not going to do this. And he didn't know how to respond to that scenario. Now, my former OB who convinced me to do RhoGAM, she had a longer speech about it. She had a longer explanation to sensitization and all that stuff. But this guy, he was just very much like, because I was asking him, like, if I don't take this shot, if I don't get the RhoGAM shot again at 27 weeks, then what will happen? And he was like, well, if there's a blood mixing, your baby could become sensitized. But there was a big disconnect between, there's this whole narrative in the RhoGAM sensitization, blood sensitization explanation about how it's not about the baby that's in your uterus, it's the next one,
Mhm.
right? Like it's not about the one
Why don't
that's
we why don't
there.
we talk about this just
Yeah,
briefly?
let's talk about
Hmm.
that.
Yeah, the red blood cells, like every cell in your body, they express proteins on the surface of the cell. And some of those proteins are going to be considered native, like they're your own proteins. So you're generally, unless you have an autoimmune condition, which is certainly something a lot of people deal with, you're generally not going to have any problem. Your immune system's not going to have any problem with those proteins being around. So the red blood cells are circulating around and they're just waving at the immune cells like, hey, Ted, hey, Larry, hey, Georgia, and they're having a good old time in there. But if there's a protein in there on one of those red blood cells that is looked at as like, whoa, you don't belong here. Sort of like, Germany, everybody who was wearing one of those those like, arm sleeves, arm cuffs, like to mark you as Jewish, like you're going to be treated differently.
Hmm.
So the immune system goes after this red blood cell that has a protein there that doesn't belong. That protein is called RH factor in the context of what we're talking about. And the reason that it's circulating in mom's bloodstream is because the baby must have a different blood type, specifically an RH positive blood type. So that's A positive, B positive, AB positive, or O positive. You are RH negative. So you have either A negative, B negative, AB negative, or O negative. When you have a baby inside of you that is RH negative, like if you're A negative and your baby is A negative, there's going to be potentially some fetal blood cells that circulate in your system that are just passing through. Like nobody knows, no surveillance immune cells are going to be seeing that as a threat. But if you have a baby that has a RH factor on their blood cells, then those cells are going to start to be seen as a foreign invader, right? And the first thing the immune system does is try to destroy those blood cells in your circulation, which is fine because you don't need the baby's blood cells in your circulation. But then you also produce antibodies to it. So the way that baby's blood cells get into mom are through the birth experience, through miscarriage sometimes. There's some other things, where you get placenta needs to be, scraped out or something, postpartum or whatever. There are instances in which there can be sufficient circulation or mixing of blood between mom and baby that you would produce antibodies. And the reason antibodies are relevant to this conversation is that the baby that helped to generate those antibodies is not in danger. But if you have another baby, which is likely if you have multiple kids and you have a husband that's Rh positive and you're Rh negative, you have another baby that's Rh positive, and some of those cells do come into your circulation. I'm sorry, if you have a baby that's Rh positive in the next pregnancy, after enough blood has passed into your circulation from your previous baby, who was also Rh positive, then those antibodies can mount a very rapid response against the new baby that's growing in there with Rh positive blood. And so what we generally see is that your baby's blood cells, the growing baby's blood cells, are all destroyed by your immune cells. And so their blood gets super, super, super um, uh, it's like not viscous, whatever the opposite of that would be. Like it's almost super liquefied in a way because it doesn't have the viscosity that is provided as a consequence of there being all these blood cells in there. So the baby will potentially, in some cases, pool fluid in different compartments in their body, which we call fetal hydrops. But the risk of that happening is around 10 to 15% if you never got RhoGAM. There's a catch though. If you get the RhoGAM, presumably it drops it down to like 1 to 2%, this risk of alloimmunization, that process I just described. The problem with RH right now in the people, well, first off, it could be whole blood that's from a person who had the COVID vaccines and all that. That's one part of the conversation. The other consideration is we don't know how much RhoGAM to give to prevent that alloimmunization from happening. So we just say, hey, just take the whole slug, whole syringe of it.
Hmm.
Nobody's actually looked at whether or not like maybe a little whiff of RhoGAM is sufficient at this part of the pregnancy, or you got to double that for postpartum. We just give you this big whomping dose, which
And
could, in a
could
person
you
like you,
could you
yeah,
explain what is in RhoGAM that
sure.
would potentially prevent someone from having their immune systems, these cells attacking? And one other question I have on top of that. when you do genetic testing and, test for the gender of the baby, you're giving your own blood because the
Right.
baby's blood is circulating in your blood system, in your
Right.
blood, and to an effect, right? What's the difference between that baby's blood being in your blood and a traumatic blood mixing event
Mm-hmm.
that they're referring to when it comes to RhoGAM?
Um, the so the so what you're asking is when we do like a non-invasive prenatal screen and they want to look at the sex of the baby based on a blood draw at like 11 weeks, um, they can determine what the sex of the baby and a relative risk for things like trisomy 21 and whatnot. It's called the NIPT. It's not really a test, it's a screen, but it's super specific, super sensitive. It's almost as good as a test. What's the difference between doing that and this mixing of blood? Because if we have enough information to be able to probe you, get a blood draw from mom and determine the sex of the baby, um, doesn't that mean that there's like blood cells circulating? No, because what that non-invasive prenatal screen is looking for is little tiny fragments of the baby's genetic makeup that do not correspond to what mom's genetic makeup is. And the only reason that I guess that they're able to tell that is that they're able to determine like they're able to see that okay, mom's whole red blood cell is here, and we can dissolve that and we can see here's the genetic material, and then there's these little fragments that don't match up with that, so it must be fetal. There is so that's very different from whole blood cells from the baby circulating into your circulation, and those whole blood cells have proteins on the surface. Those proteins are what trigger an immune response. The little snippets of like presumably little snippets of fetal DNA that are circulating through your system when we do the NIPT, that blood draw, those are not going to have those proteins that mount that elicit an immune response. So it sounds like magic, and it kind of is, because frankly, I'm not even sure exactly how that test is able to distinguish between mom and baby's blood type, but it does seem to have been validated, and we do generally trust that result. But your next part of your question was the RhoGAM thing.
Mm-hmm. Yeah.
What
What's it
is
made
in
out of?
RhoGAM? So let's say that you had an RH, you're RH negative, which you are, and you had a baby that was RH positive.
Which I
And
have.
after that, yes, and after that, you were found on a what we call type-in screen. There's an indirect Coombs test, which basically looks for antibodies to various things. It's called indirect because we're looking for antibodies against the antibodies that we're searching for. It's not relevant. But when we do a type-in screen, what we're looking for is what is your blood type? And do you have antibodies against any of those common proteins that are found on the surface of blood cells? If you were to go and get a type-in screen when you get pregnant, which you might in this pregnancy, they'll do a type and they'll say what is your blood type? So let's say that on your type-in screen they said, ooh, you're positive for some RBC antibodies. Let's go and figure out what they are. They find that you actually have anti-RH or anti-D, another word for it, antibodies. That means that you've been alloimmunized. That means you have antibodies against RH factor, meaning if you have another baby inside of you that is RH positive, you could, in theory, mount an immune response through antibodies and destroy that baby's blood system or blood
Mm-hmm.
supply.
Mm-hmm.
Um, Okay, we've established that part. So what is RhoGAM? RhoGAM is a product made by taking somebody like Rebecca's blood that has antibodies against RhoGAM, and they are against RH factor, and they probably do some magic with it, but then they inject that into a person who hasn't been alloimmunized. And
So
what,
it would be someone with negative blood type that has the antibodies
yeah,
against it.
yeah. So
Okay.
what we're trying to do is we're trying to prevent another woman from making antibodies against Rh factor. So we give them whole blood from somebody that has already gone through this process, and it serves the function, from what I understand, of basically blocking the new person's immune system from making that response. We don't want them to produce antibodies. We don't want them to even see this as a foreign invader. We're going to mask it. And so that next person, or you in your pregnancy, if you get a shot before you give birth and then a shot after you give birth, we drop that risk of that immune response and the antibody production. We mask that and prevent it for the next pregnancy by giving you those 2 shots. So that's what we hope to achieve with it. But we
Mhm.
don't know the appropriate dose. We don't really know what's the minimum effective dose. That's where most of the controversy lies. And I have women who've had like 7 babies. They're Rh negative with Rh positive babies, and they haven't alloimmunized yet. So that's a
Yeah.
pretty unlikely scenario. And I do feel
Yep.
like that risk of 10 to 15% is probably an overestimate. It's probably way
Hmm.
less than that. And I don't think we fully appreciate why. Sarah Whitcomb has a great book on RH. I think it's called
Anti-D.
like Anti-D. Yeah.
Yep.
That explains some of this.
I tried to get her on the show, but she's like booked for 3 years.
Yeah, which is pretty cool.
What do you think about the fact that the initial RhoGAM trials for testing RhoGAM was on men and only men?
Wait, say that again.
The testing that they did, the medical testing for the theory behind RhoGAM, it was performed on men, on male patients. It's never actually been studied on women because first they can't study things on pregnant women because it's considered unethical.
Yeah, this is the answer to that is probably that to answer this, you have to actually appreciate how is research conducted. And to do research, you have to go and write a grant or write a grant proposal and get a bunch of money. But that grant proposal is going to say, hey, here's how we're going to do this study. And the reason that research is so cool and so hip in the academic world is that when you get giant papers published, especially if they change a person's clinical practice, it gives you a little bit of extra like trip spot when you're walking around, like, oh, I got published in Nature or whatever. So everybody wants to get published, and they want to have a result that is really, really statistically significant, meaning the result that we saw or the effect of a drug or whatever else was far stronger. It was a far, far more significant effect than you would expect by chance. So it's similar to saying, like, if you flipped a coin 10 times, you would expect it 50% of the times to be head, 50% of the times to be tails. But
Mhm.
in this trial, when I flipped a coin, it was 90% of the time heads and 10% of the time tails. That's statistically significant, way, way more than we would expect by random chance.
Mhm.
So in order to do a good study, which our gold standard is called a randomized controlled trial, you have to eliminate any possible confounder, um, meaning any attribute of your test subject or the test protocol that could potentially interfere with an sort of medicated, so to speak, uh, study. So what I mean by that is that if we were to study 100 people, we want them all to be roughly the same type of person so that when we look at the effect of a drug or an intervention or whatever else, that we can't say, well, gosh, maybe it would have been different had, maybe there's a difference between men and women. We don't have enough people now to do a sub-analysis. So what they try to do is they try to get a homogeneous group of people, meaning people that are almost identical in height, in weight, in age, in race, in ethnicity, in socioeconomics, whatever. The problem with this is that the people that are most likely to volunteer for studies are young, healthy men. And the reason that young, healthy men are great test subjects is because they don't have menstrual cycles.
Mm.
So across let's say a 30-day menstrual cycle, um, you're going to have fluctuations in various hormones, various physiology, various biochemistry pathways, biochemical pathways. There is going to be a difference in how your gut works, how your brain works, your whole nervous system operates differently in the follicular phase versus the luteal phase. So women are naturally poor test subjects in randomized controlled trials. So,
Because
so
we're so
what that means,
complex.
you are far more complex than the physiology, at least as we know it, of men. And so what most studies look at are men of about the 20 to 40-year-old range. They're generally in good health, and they're very often athletes because athletes are very disciplined and they're very willing to do the thing the way the protocol was set out to do. So you're already biasing any result from most literature, not all literature, but much of the literature that is randomized in randomized controlled trial format. Double blind, placebo controlled, all of that we all talk about as being really important. You're going to find it in a bias towards young, healthy men because women are not good test subjects because they fluctuate on a month-to-month basis. Not even a month-to-month, a day-to-day basis throughout a month.
Yeah, throughout the month. Yeah.
Right. So I presume, like with most research, that's what we're seeing with RhoGAM. I actually didn't know that, but also I don't know if it necessarily would change my perspective on things.
Sure.
Um,
Because it sounds like
Simply
you're pretty
because,
used to that being the
yeah,
way that
exactly,
it's done.
exactly. It's like, of course it is, because
Of course
we
they
don't we
did.
we don't ever study women, especially pregnant women, on in anything. So
Yep. Yep.
so the data is usually very, very sparse, and we try to draw, really sweeping generalizations from those studies, and it doesn't always serve us well. Sometimes we're kind of
Hmm.
stuck to doing that, like we have to do it that way, but it very, very rarely serves us super well.
So, question then, the output of this is, do you believe in RhoGAM or no? Should women be getting RhoGAM?
I don't like using shoulds. I think that uh, I think that I think people should not get the COVID vaccination or the booster. I think they should be completely withdrawn from the market. I can say that in good faith. Um, I have seen a number of babies who have developed hydrops fetalis, which is the collection of fluid due to the loss of viscosity in their blood, collection of fluid in the baby's body, and the baby dying. I have seen that. It's not the worst thing I've ever seen, but like when you've seen a lot of bad stuff, your practice tends to be altered by that. We know that actually through a variety of studies. What I will say is I am all for a person being fully informed around any risks or benefits or alternatives to any procedure. And that goes for induction. It goes for C-section. If you want to have like an elective C-section, go for it. Is that what I would do? No. Is it, would my wife and I get RhoGAM if either of us was Rh negative? Or if my wife was Rh negative, I should say? No, probably not, because I think we're talking about a fraction of a percentage. But do I
Sure.
think we shouldn't be offering it or talking about it? No, I had a midwife who used to work with me who said, I said, well, how did you talk to her about the vaccines? And she was like, about hepatitis B, let's say. Oh, I don't talk to my clients about that because I don't believe in it. Well, like scientific inquiry, or let's say science itself is not a belief system. It's my job not to tell you how to think or how to be or how to live your life. It's my job as a doctor to give you the full complement of information in a respectful way when you're not under duress with like, in the middle of labor, so that you fully appreciate the pros and cons and alternatives, and then to
Mm.
support you in that decision. And if I'm not comfortable with you doing X, Y, or Z, then it's my job to find somebody who might be more comfortable with that. That's it.
Mhm.
So with RhoGAM, I do teach this in the Born Free method. I will tell people if it was me and my wife, we wouldn't get it. But if you're open to this and this is what you want to get, then I think it's a very reasonable thing to do. Do I think we should be giving the full dose? No. Do I think we're giving it to too many people? Yes. Do I think it's necessary in every single situation when you're pregnant, Rh negative, including a 6-week blighted ovum miscarriage? No. No. There's almost zero chance of you alloimmunizing after a first trimester loss. Um, but we love protocols. We love to just box it in and make it neat and tidy. If you're Rh negative, you get the shot. I think there's always room for more conversation and nuance.
Yeah. Yeah. It's kind of another line item too, right? I mean, I've heard a lot of women who they either knew that their husbands were negative blood type like them, or the stance that their practitioner took was, well, we don't know if that's the father, and have pushed RhoGAM either way, regardless of
Yeah.
whether there was a true potential. So I think in some cases it can, be that. But I think what I hear you trying to, or I hear not trying to, I hear you pressing into those listening today is we all know the COVID shot's no good. We
Yeah.
have no way of parsing that out from the potential of that mRNA being in the RhoGAM injection because it's made from people's blood. And if someone had that shot, it could potentially be in RhoGAM. I mean, it's just the same as I hear and see women all the time asking for breast milk donations. And
Yeah.
like, if you've had the jab, no thanks.
Yeah.
So, same kind of thing to consider. I mean, I stand where I stand on it based on my own experience. It's like, been there, done that, had a bad reaction. No thanks. I opt out. I unsubscribe from this. And, I'm just going to, like everything else with autonomous birth and making these choices, leave it up to God. It's in his hands
Yeah.
now. There's nothing I can
Mm.
do about it.
Yeah.
I didn't create my body. I didn't create my husband's. I mean, technically my body is creating my children's bodies, but I'm not doing anything. It's
Yeah.
doing it itself.
Yeah.
I
Yeah.
know, I've kept you on here for 100 hours now, and I appreciate you taking the time to talk with me. Let me run through this list real quick. You tell me if you want to answer anything or if you want to just jump off, that's fine. So from the home birthers, should men practitioners really be in the birth space? What part of hospital birth made you walk away? And again, that was asked like 17 different ways. What
Yeah.
would you tell current or new labor and delivery doctors? So that was from home birthers. From non-home birthers, is constant excruciating pain when fully dilated, even between contractions, normal? I'm not a doctor, but that doesn't sound great. Use of tinctures, waste of time or worth it? A lot seem to make them for reducing risk for postpartum hemorrhage. Do
Yeah.
you screen the people you'll accept for home birth? Would you support a mono twins for home birth? What about
No.
insurance? The midwife team
Don't
I
use
have,
insurance.
what's that? Don't use
I
insurance.
don't accept insurance. Momo twins, I would not do it at home. I mean, unless that person was like, I would rather you. I'm gonna free birth if you don't attend my birth, and I accept that there's risks. I just want somebody there in case there's something that you can do to help. I would be willing to consider it, but Momo twins are generally not what I would do at home. It
Can
just
you
doesn't.
explain why to people that don't know about twins?
Yeah, so if the twins are separated by bags, meaning either Mo Dai or Dai twins, then they are relatively separate. Like their cords and everything are separate. Momo twins, almost invariably, I don't think it's reasonable to even expect that they're not going to be tangled up completely. So one twin has the cord around twin B's cord around their arm, and twin B has twin A's cord around their neck. Like they just get tangled up inside there. It's like natural.
Mhm.
Does that mean that Momo twins in never ever in any situation could ever be born vaginally? I don't think so, but I'm sure that they have in the past. It just seems to me like sort of one of those like, man, there's a great chance that we're going to need an operating room rapidly here.
What would you think about, or what would you say to a free birther who's never had an ultrasound? What if they have Momo twins in there?
Well, you wouldn't know until they came out, I guess. And
Yeah,
if they
you
come
wouldn't
out,
know.
then there's our
There's
like,
the
hey,
answer.
proof of concept. It can happen. Yeah. Yeah.
Or let's see what other
Yeah.
ones on here.
I don't work
Midwives,
with insurance. A lot of people ask that. Yeah, I
yeah,
don't accept insurance. That's a
most
whole
midwives
scam.
don't.
That's a whole
Mm,
separate 3-hour conversation.
I know, and most midwives don't, or home birth supporters and all that. I have heard that you can bill after the fact, but
You
I
can.
don't
You'll
know.
get some money back, usually reimbursed. But people need to appreciate that back to what we were saying about the medical system, playing in that sandbox and paying a premium every year for insurance that doesn't even kick in until you hit your deductible and you do all your co-pays and you have your monthly
True.
premium. Like once you do all of that, the insurance company might start forking it over. But even that is a negotiation with the hospital, and you're going to end up paying way more if you're billing insurance than if you pay out of pocket, whether it's in or out of hospital.
Yeah.
So we have a big problem in the health insurance scam. But I don't do it because I don't get paid to do a lot of the lifestyle intervention stuff that I do by the insurance companies. It's not billable. Like there's literally no way for me to get paid. Like I'll get $20 for doing a well woman visit, and that's just not worth it to me because I'll spend sometimes 3 hours in a consult with people. So
Yeah. Yeah,
yeah,
absolutely. That's definitely a whole conversation, insurance
yeah,
in general.
right.
The midwife team I have only delivers at the hospital. What questions can I ask about expectations? And then I'll just throw these other two out there and you can kind of circle to what you want. How would you support a client with a history of shoulder dystocia? And what is the plan if there is a true emergency? For example, I'm 45 minutes away from an ER.
Yeah, I
So
mean, you have to
that's all the ones
decide.
asked.
Yeah, not everybody, I think, needs to have a home birth. Um, of all the things that we train in, uh, like emergency wise in the birth space, shoulder dystocia and hemorrhage are probably the two that we get the most practice with because it also does happen more often than people like to believe. It's not
Mhm.
like one of those phony things where people say this could happen, like you could get penile cancer if you're not circumcised. Like that's baloney. Um, but like that, stop. Like, but shoulder dystocia, like that is not one of those like fairy tale things. Like there's a lot of shoulder dystocia. Now, whether or not it's actually a true impacted shoulder, probably that's probably relevant. There's probably very few actual true dystocias, but when it happens and the baby's bone is hitting into this pubic symphysis, that's like the pubic bone in the center,
Mhm.
you have to know what you're doing. Uh, Having said that, when a person says, I have a history of a shoulder dystocia, that's where my mind goes. Like, was it really a shoulder dystocia? What had to happen for it to be resolved? Because if it was just like a pushing and then I got on all fours and it resolved, not a to me, not a real shoulder dystocia, but for those out there who weren't prompted to get on all fours when a shoulder dystocia was identified, that's the first step is get on all fours. I wouldn't say
Okay.
that on my oral board exam, but that almost always relieves it, because that's a midwifery movement. That's not what we talk about. I did that on my boards and I was like, well, if I was, I probably would get them on all fours. Oh, but you're not practicing like a midwife. And I was like, okay, all right, let me think like a doctor now. But
What's the
that
next answer?
actually is
What's the real answer? Cut the baby out?
no, no. There's things like you can deliver the posterior arm, you can do wood screw, Rubens maneuvers. There's all these other different techniques you can use.
Okay.
But getting them on all fours changes the baby's relationship to the pelvis. It actually can
Mhm.
sometimes open up that outlet of the pelvis. So anyways, I would want to make sure for starters, was it a true dystocia? And if so, are you willing to perhaps accept that that might happen and that there might be a real catastrophe that you can't get access to help for immediately? And if not, then that home birth is just not a right idea. It's not my job to convince everybody to have a home birth. It's my job to say, hey, the vast majority of women are probably close enough to a hospital, first off, and probably are healthy enough to expect that they can have a baby without any medical supervision whatsoever. And if they have a midwife and a doula there, that's probably sufficient. If you need a little extra help, there's a doctor available, you know, up the street maybe, and me, or you just go to the hospital. So it's up to every single person to not be looking for somebody to convince them that a home birth is a good idea. If you feel called to have a home birth, that's probably the best place for you to have a baby. We haven't even talked about the nervous system and everything and how that all
Yeah.
responds to where, your birth environment, but that is actually an important factor. So, to that person asking that question, I say, if you're not feeling like called to have a home birth, then don't. Like that's okay. Nobody should correct you or condemn you for having a hospital birth. That's okay. When you're in the hospital, that's where I think navigating that space is really, really, it's tricky, but it's very important that you practice saying no, thank you, but also really knowing what it is that you stand for, you and your partner.
Hmm. Yeah. Or perhaps repeating what they did in the last birth that released the shoulder or studying different positions that they could get into
True.
to potentially,
Yeah.
you know, because I think
Yeah.
the thing that's hard for thinking about this space is when someone says, I really want a home birth, but I'm, this scenario, and then going into the system, it's not going to be the same. I mean, you can be as educated as you want
Yeah.
and still, birth is not the time for you to be arguing with people, first of all, or fighting with people, or having
Right.
somebody that has to stand up for you. Like you said, all the way that our we go into birth, you were mentioning the nervous system, and it's not exactly what I'm talking about, but at the same time, it is. Who is in our birth space matters. And
Yeah.
for example, when my midwife ended up backing out, I was like, well, then she wasn't meant to be there.
Yeah.
This is everything's falling into place because I wouldn't want someone who is afraid or has any fear or could have slight concern to even be in that space, because then they bring that fear and that negative energy potentially into that space. I'm planning this next baby, and my mom always comes in. Actually, all the birth videos that you see on my page, my mom took.
Oh, cool.
She's been present, which is cool. So it's been my husband and then my mom, um, was there. And she talked about my dad potentially coming this time around to just keep an eye on all the other kids. And they were just here over the holidays. And I was like, Dad, I hear you might be coming. And he's like, oh, am I getting volunteered for that? I don't want to be here for that. I don't want to see any of this stuff. I'm like, well, you're not invited, first of all, to see any of this stuff. But would I even feel comfortable with him being in the house giving birth? Like, that's
Yeah.
something I have to think about as the one who's giving birth. It's like, would I feel weird if knowing that my dad is here? Like, if I feel like I'm going to scream or whatever I'm going to do, I'm going to, I need to be able to feel comfortable doing that. And I've heard a lot of birth stories from women who have had people in their birth space that they shouldn't have, that they then later, felt didn't feel completely comfortable and had a long, slow, drawn out birth. And I don't want that.
Yeah.
So, it's
Yeah.
something that I think that women need to consider. So, anyway, any
Yeah.
other of these other questions you wanted to respond to? You don't have to, but just,
I don't know if any of those jumped out to me. I mean, the whole being a man in birth, I think that there's more to that question that we haven't really addressed. But,
mhm.
at the end of the day, uh, I think it probably is perceived by people that like it's kind of there's some sort of, mm, I don't know, the like OBGYNs, males are all perverts because they get to like see vulvas and stuff. Like, I'm not sure what part of that is like driving the perverts to go to OBGYN. I really don't know. I don't think that that's the situation. Um, what I will, I'll add to that though and say that, yeah, I think men have done really, really horrible things to women over the years. We've talked about a number of them, but also uh, when you survey a population of people, and you can actually try this on your Instagram and tag me. I'm curious. But I've done this, and the question is, w- has a if you think back to the worst experience you had with an OBGYN, were they male or female? It's a 50-50. All the men are not the bad ones necessarily. I'm sure there's a lot of bad ones, but there's also a lot of women that are not being very kind to other women.
I
And
agree.
in my
Oh, I
in my
agree.
experience, it was like the majority of female OBGYNs were actually harsher against women than men were. Men were almost like, I'm gonna be very, very gentle. And the women were like, come on, you had a baby. And it was like, oof, that's not how I would treat my own wife, and I hope you never get to touch my wife because that was not
Yeah.
very kind. So I think that we have a medical system. There's a lot of people working within it that are, uh, I, th- I it's a little sociopath. Like it's a little bit like they're the captain of the ship and they want you to know how smart they are. There's a lot of that. These are all good people
Mhm.
that got into a space where now they feel like in order to, they have a chip on their shoulder in order to like flex their intellectual status or something. They need to show you just how smart they are. But ultimately, if you can appease to either a male or a female OBGYN, appease to them in the sense that you're like, listen, I don't mean any disrespect. I really just want to have a conversation. I think most of them are actually going to be pretty open to conversation. They've become so, we all doctors have become so conditioned to a person coming in wanting a silver bullet or like a magical fix for something when it took 10 to 20 years maybe to develop your problem. I don't have a magical cure. I don't have a holistic remedy for that thing. We have to actually develop a relationship and we have to go forward together and try some things and see where we can work. But if you're a consumer that's demanding a quick fix, whether it's in the form of an injectable pharmaceutical or a surgery, those OBGYNs realize that like they can more easily cater to you, to those people. If you go in and
Yeah.
you're like, listen, I understand that there's a lot of good things out there. I want to have a conversation around this and not have pharmaceuticals and surgery. Is there anything you can do? And if they're like, sorry, I didn't train to do that, that's okay. That's true.
Mm.
But at least you've had the conversation. That this like mudslinging between midwives and doctors and patients and all this is just, it's too much for me, which is another reason why I'm so happy to be out of it.
Mhm. Yeah. What I hear you saying is that because the medical complex is a business, in a sense, you're going to someone for a service. So tell them what you're looking for. They will tell you whether or not they're a fit for what it is that you're looking for. I mean, when it comes down to it. And if it's not a fit, then move on. I mean, that's kind of what a lot of women are, the situation that a lot of women are in now and why they're seeking home births. And then, that's the thing that makes it tough though for a lot of women, especially in the area where I live. I know the midwives in my area, and I personally, while I think that they're wonderful, beautiful people, are not a fit for me
Yeah,
personally to attend my birth.
that's right. And that's
And
okay. Like
and
that's fine.
that's the
That's
place that
on
I
us
have to
to
come to,
figure
right?
it out.
How does your wife feel about you being in this field and like all the birthy stuff? I mean, in some senses, she's probably like, this is great because it sounds like you guys have had two babies in the last couple of years and you've been there to support her.
Yeah. Well, she's been with it through thick and thin. Med school, residency, fellowship, and then even when I was still in the hospital after all of that, uh, one big thing for me was I need to get out of the way because now I'm an expert in how to give birth. And I'm always the guy that's like, she's Mexican, she's traveled when I met her in high school. We've been together since we were 16. And when we met, and I was like, oh, I really want to learn Spanish. I went in and I learned Spanish and I made the mistake of correcting people's grammar, and she's like, dude, I grew up speaking this. Like, let this be mine. She did karate when she was little, and then I got into competitive judo when I was college. It was almost like I was trying to be like her because I like had such an adoration for her. And so this was like the story of her life. And then when we got pregnant, I had determined that I'm going to take a step back and like let her be the full. I'm not even the co-pilot. I'm like the flight attendant in the back. Like you do you. But I stepped back so far that she actually felt like like we were not connected super well
Hmm.
in our births, which is a regret that I have, and then I will always will have. But there was a confrontation for me to be like, dude, man, do I really believe this? Like, I talk the talk, but can I walk the walk? Our first birth was in the hospital, but we went in at 10 centimeters and had a baby. Um, the second one, we did it at home because it was like dead center of the COVID stuff at the end of 2021.
Mhm.
And we decided to have a midwife and everything. And it was like, man, if I really believe this, like, we're going to have to go through this. And it wasn't as
Mhm.
hard as I'm making it sound, but there was a moment there where it was like, home birth, what if something doesn't go right? And I had to just surrender to that. But we did, and I was like,
That's interesting.
yeah, home birth. We had a home birth. I can go boast about it on Instagram now.
So you were a
But
little, even you had that concern in your mind, which I think is very
yeah, it's healthy to,
normal and human of us, right?
yeah,
Especially
just
after
thinking
being
about it.
in the system and
Yeah,
experiencing
yeah,
things.
yeah. I mean, you experience a lot of bad things. Like that's what people don't appreciate about OBGYNs. They've seen some horrific stuff, and they don't
And,
want that to happen again.
even midwives too. And I think that
Midwives
that's
too.
something that can become tough is when they have
Yeah,
experienced tough births. long ones or things where bad things happened or
Yeah.
stillbirths or, whatever the case might be,
Yeah.
transfers that things weren't great. It
Yeah. Yeah.
shapes your experience and the way
Yeah.
that you're going to react to things.
Yeah. It colors everything. It does. It really does. Yeah.
Yeah, I've watched a
Um,
couple. I've watched one midwife in particular whose transfer rate has just like skyrocketed the last couple of years. And I think I obviously don't know all of the stories, but my assumption from the outside is, she's seen some things and now she's erring on the side of caution.
yeah. Yeah.
But I'm not, I mean, it's her deal, right?
Yeah. Well, yeah, and we actually have data that does support this notion that doctors who have had bad outcomes tend to have like lower thresholds for intervention because they just can't. Our fear of mortality, like as a society, is reflected in doctors too. Like we don't want babies to die. It seems unfair that a baby would have to die.
Mm-hmm.
And in many regards it is, but it's also a part of our like the fabric of our mortality. Like not
Mm-hmm.
every baby is going to make it through this. And
Mm-hmm.
that's a hard pill to swallow. But for a doctor, they then carry that as like, oh, had I done this thing differently, whether or not it's
Mm-hmm.
true, that wouldn't have
Mm-hmm.
happened. And same with midwives. So we know that that colors their practice and maybe even over the long term modifies how they view informed consent, birth plans, and whatever. So, you have that first breach, that baby dies or something. It may not even have been related to the breach, but it now gives you this
Sure.
impression that breach is super dangerous.
Sure.
I never really told you what my wife thought about all of this, but she never once thought that like, oh, my husband's a gynecologist. She actually was always very proud of me and supportive. Like, I don't think it ever occurred to her that that's can you, like, she's like, he's not in there having sex with people. He's like doing his job. Like, and I don't even think
Yeah.
it occurred to her that it was like, yeah, I guess that is kind of weird. Until I started doing like hand gestures, like I'd be like, I was doing an exam. She's like, can you stop doing the hand gestures? And I'm like, yeah, 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 sorry.
She's like, all right, this is getting weird now. Oh, I don't know about
Yeah,
this. I
yeah,
mean, but I even had to kind of, like I said, it's not something that I've thought about from that perspective either until, I have to have you and I were preparing for this. I'm like, I have to have the critical conversation. This is what people want to know. People want to know about this. There is a concern there, or not necessarily a concern, but I know that us, women in the free birth community, they don't want anybody there, let alone a man.
yeah, 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 yeah,
It's a totally different
totally.
world, It's a different
Yeah.
bag altogether. But I really appreciate you taking the time to talk to me. I hope that this wasn't too far off the path of what you were hoping for in the first half
This
of
was
your
pretty
2025.
great, actually. No, this was pretty great. You're the first one I've done, and I thought, I hope you're going to release this whole thing because it's been like, what is it, 4 hours or something?
I've been timing. We've
Um,
got 3:43
Dang,
and I started after like the intro, so there was maybe another 5 minutes or so. So
that's
I'm
amazing.
going to break this up into
Yeah,
multiple episodes. I mentioned Dr. Stu to you before. He was on the podcast, gosh, I think it was two
yeah.
years ago. 2 years
I
ago in
saw, I
January,
looked it up
actually.
actually. I looked it up
Yeah.
and I was like, ha, twice, I
He
doubled his time.
and he did two. Yeah, he was here for a while. And then he was like, I gotta go very abruptly. Like, I gotta go. I'm done. And I don't blame him. But, he
Yeah,
was loving sharing all the stuff. And he really went into the whole medical system stuff. So it's good. But anyway, actually, so those episodes are some of the most listened to episodes of all time. And so I have a feeling these are going to be too, because people want to
yeah,
hear, you especially women in the home birth space, they want to hear from folks that have like seen the real
yeah,
stuff. And then like now they're out. Like, what was it like in there?
yeah. Well, I mean,
And
it's like watching a car wreck, like it's like we all want to hate on the doctors, but then whenever somebody steps out of bounds, you like want to like get inside of them. I totally get that. I meet doctors like that, and I'm like, I want to know your story, because every
yeah,
one of them worked very hard to get where they are, to make the decision, to make any decision that's going to take away or I don't know, invalidate or in some way the literally the journey you started when you were 18, pre-med student in college. I mean, that is like, we have to give people credit when they are. Like, I'm not saying this to toot my horn, but Stu was one of my
Oh,
mentors,
yeah.
residency, like
Mm.
Dr. Stu. Bliss, his partner, like I was at a birth with her when she was still apprenticing with him when I was in residency. Like, when you meet these types of doctors, for me, I want to like get to know how they made such a radically unusual decision to break away from a career that had the potential to make you 40 years of decent income, not like millions, but a decent income, and have respect and prestige and awards and
Mm-hmm.
the white coat and all that. Uh, I'm 40, so 40 this year. So like I have 20, 30 years more of doing this. And
Mm-hmm.
it's exciting, but it's also like, man, I can't imagine these people that are doing this for 20 more years and then they step out. Like, I want to I want to go and give them a hug. Like, that's a really hard decision. So when you
Yeah.
meet doctors that have made that hard decision, I hope we can all give them a little grace until they cross us, and then you can come down.
Absolutely. Well, I give you tons of credit. And, that's why I said this is going to be a tough one for me because I feel that you really respect birth and you really respect the birth space and you respect home birthers. And it sounds like free birthers too, that you're just like, cool,
I
do your
respect
thing.
women. I respect women and fathers for what this is. I
So
have a deep reverence for both of them.
that brings up a really good point, and I think this is something that you do in your class, in your
Yeah,
born free method, I think it is, where you're supporting, both husband and wives. But I see a huge need for support with husbands when it comes to birth. I mean, obviously, with home birth, as a home birther, I see the need because I get so many women that are like, my husband's not on board and I want to do a home birth. And then that conversation's always,
I've
a
got
deep
the
one.
prescription.
Do you have it?
Got the
What is it?
prescription. Yeah,
Tell me.
yeah.
Okay.
So young men, going back to the witch hunts, there's this deeply like wounded masculine where we want to protect women, right? And sometimes it comes out in a very toxic way, a very like sort of controlling way. But when we were born, little boys, we heard our birth story around the table. Our moms telling our grandmothers and our aunts and whatever. And there's oftentimes a lot of language that's very negative around how painful, how hard it was, which I'm sure of course it was painful, of course it was hard, but that's the language that we hear in relationship to when we were coming into the world and our mother going through terrible pain, maybe nearly dying. I was ripped open. Those types of language, uh, uh, of little phrases, they stick with us even before we can understand what they mean. So that plus this cultural milieu of messaging that birth is unsafe and it's dangerous and something bad is about to happen at every moment. We men hold that within us, and we then fall in love with a woman. Usually, this is how it goes. We fall in love with a woman.
Usually.
We yeah,
Hopefully.
we have a baby, and yeah, and this is certainly how it went for me. And then our partner is going to have a baby, and we become afraid for them because we remember how harmful birth was to our mothers.
Mm,
And so we then become very protective of our partners because they're now the one that we're the most in love with.
mhm,
But we never forget harming and maybe even making our mothers feel like we almost killed them.
mm,
And in some very rare instances, we do kill them. And on a maybe an identity level, we did kill them, and we
mhm,
know that our moms and our dads never were the same after our birth, and there's all this stuff, and mom's
mm,
body changed, and all this stuff, all the stuff that we hear. Men are also hearing that. So what I have men do, here's the prescription. Because home birth then is like, absolutely, that sounds crazy. It's so
mm.
unsafe. You're gonna die. Your head's gonna pop off.
Yeah. Yeah.
Like all this crazy stuff's gonna happen if we're in the
Everybody's
home.
going
We
to
need to
die.
be in. Yeah, the house is just gonna erupt in flames. Um, Here's what I have men do, and it's sometimes helpful for their female partners to do this as well. Go to your mother and ask her to tell you the story of when you were born. And if you have a mother, you can do this. You can also ask your father. But um, ask them, and they're going to tell you like, oh, it was so hard, Johnny. I had, you split me from front to back. These are some of the terms I've heard, and even in my own birth story, like, oh, it was so terrible, and I was so in so much pain. I couldn't go back to work, and my nipples were cracked. It was like, but what about mom? So that's the first part. But then you say, Mom, think back to when you held me for the first time, and you'll see something switch in a woman's eyes, like our mother's eyes. And she'll go back to that moment. She will remember it so viscerally, so vividly. Oh, you smelled like this, and you had these little fingers, and were making this little face and these little noises. They will remember the noises that you made, and they'll talk about just how incredible it was to hold you. And that will help those young men in their subconscious become reprogrammed to realize that there's something far more important here about birth. And now you have a woman in your life who's going to give birth to your baby, usually. and and they're going to get to go through
Hopefully.
this. They're going to be holding a baby that you created with them. And they're going to go
Hmm.
through that. And it's going to be really hard. And they're probably going to feel like they're dying. But that's not the only story. That's not the only chapter. There's all these other emotions that are layered in there. And so having men go and have their own birth story retold to them is like therapy beyond its years. That's worth like 10 years of therapy for us men.
Hmm.
So it's a great connecting exercise, especially if you can do it together with your moms. But that is a very, very important way that I get people to appreciate, this apprehension is very valid, but it doesn't have to be the only conversation, the only story that you have about birth.
Hmm.
And you can tell them birth stories, make them watch YouTube videos. You can do all that, but it's not the same as hearing your mother talk about how beautiful it was for you to be in their arms.
That's cool. That's a very interesting way to go about it. I hadn't thought of that as a thing. So thank you for sharing that prescription. I think that's going to help a
Yeah,
lot of people. I I have a hard time at this point when I hear people's birth stories. Like I've heard my husband's birth story, and I'm just sitting there the whole time going, intervention, intervention,
yeah, yeah,
intervention,
yeah,
and then
yeah.
that's why,
Right.
I'm like putting all the pieces together of why it turned out in the way that it did. But I see the value in recalling those things. So thank you for sharing that. That's awesome.
Yeah, yeah,
Anything else for men to know, or because they need to go through this, whether wherever a woman is having birth, it's important for her husband or partner to be supportive and there. And it sounds like you had a similar experience with your wife with your first, that my husband and I had, that once I was in labor and I'm like screaming and whatever, he's like stepping in the background. I'm like, do your own thing here, lady.
yeah,
And we both had a lot of regrets about that. And, fortunately, we're able to do that over again
yeah,
twice now. So
yeah,
I don't know if you have anything else that, but again, I think what I was trying to just put out there is I see that there is a lot of room for men like you who have seen birth, experienced it, understand it, to speak to other men and educate and teach and all that. And I
yeah. That's
think that
key.
that's what you're doing, right?
Yeah, that's key. Like we meet up monthly as a group of soon-to-be dads, current dads, veteran dads in the Born Free program. We meet up every month. We have some guest speakers, and that's really helpful for men to just have other men that have like gone through this, or if there are certain marriages that fall apart through the fertility journey, because
Mm-hmm.
there's nobody there talking to the men, and because it's hard for the women. I mean, the whole thing is just really, really hard for people. But oftentimes, men, I think, are kind of they want to take advantage of the opportunity to be a very active part of this, but they aren't given that opportunity.
Mm-hmm.
So what I would encourage men is to approach the childbirth experience with not the intention of solving any problem. I know it's cliche, but just as a reminder, there's no problem here for you to solve, and you're going to get to see your partner go through some really horrific stuff, mentally, emotionally, maybe even spiritually, through this experience. And it's going to be hard for you to sit there and just be a part of it and bear witness. That actually is the best thing you can do. We don't need you to flex your muscles. We know you're big and strong. We don't care. We want to see how well you can sit on your hands and just be still and bear witness. Which is
Yeah.
why I think it's helpful for men like me to have actually been to so many births. Like that part was still incredible in our birth experience, but I wasn't like looking for a problem to solve. I was actually, for me, it was sort of like tempering my excitement. Like I was like a Labrador. Like, oh, I want to be. I'm like so excited. I'm not afraid of it so much that I'm in there, and I actually need to get my masculine energy out of the way. Most men like are stuck on the wall. I had to like pull myself back and like, like super super stoked on the whole thing.
Well, you also
Don't be
have
afraid.
this, you also had this medical background. So I imagine that makes it even
Yeah,
harder.
yeah, yeah. So I don't think that there's any. I don't think that there was any like.
One of my MacBook speakers now, my headphones died.
That's
Which
hilarious.
means I should probably go for dinner. But yeah, I had the medical background. I had all of that, but it was also trying to like your masculine energy really forms a nice like anchor for her feminine energy when she's roaring a baby out. Like she's transforming and she's arching her back and she's on different positions. Knowing that I'm just there as an anchor was sufficient for my very feminine, very like enraptured wife, in that process. But watching a person go through that, you would think that there's some problem there to be solved, but it wasn't more lemonade, it wasn't more sage. In fact, she was like, enough with all that stuff, enough. It was just being still and being present and not being
Yeah.
on my phone and just being there with her.
Yeah. Yeah. Awesome. Nathan, thank you again. I appreciate it. I'm going to let you go now. You're done. All right. If you're looking for Nathan, you can find him on Instagram at Nathan Riley OBGYN or at Born Free Method, which is, there's an Instagram account, and then you can also go to bornfreemethod.com. So thank you again. I really appreciate you sharing all of this, and we're going to have to break these episodes up, but it's going to be awesome.
Yeah, three-parter.
Yeah, there you go. And thank you all for tuning in and for being on this journey with us. If you'd like to follow along outside the podcast, you can do so on Instagram, Facebook, and on YouTube at The Radiant Mission. And today we're going to close with a Bible verse, all right? Romans 15:13. May the God of hope fill you with all joy and peace as you trust in him, so that you may overflow with hope by the power of the Holy Spirit. And we're wishing you a radiant week. We'll see you next time. Bye, everyone.
Goodbye.